Good morning, everyone. Oh, we've got a good program for you today because we are going to hear from folks at the Reddington Hospital. And you know what I've thought about the Reddington Hospital. We're lucky to have it. So at any rate, Chris Perkins is our host, and take it away, Chris.
Good morning, folks. This is Now You Know, another Now You Know, and we have an absolutely beautiful day outside the studio today, and it feels like spring. So we're definitely moving forward, and we have got a wonderful show today. And I'm actually going with some notes today because I got 3 people and 4 topics, and I cannot keep it straight without notes. So I have notes, so if you see me looking down, referring to stuff, that's because I need to keep it straight here this morning. So, anyways, to my immediate left, I have Betsy Putnam, and Betsy is the Reddington Fairview General Hospital Infection Prevention and Control Nurse. See, I needed notes even for that. So, to my immediate right is Jim Fortunato, and he is RFGH's Community Health Educator. And Jim, you've been doing it for quite a few years now, haven't you?
Yeah, about 20 years.
Oh, there you go. Okay. And farther to my right is Megan Fortier, who is RFGH's occupational therapist, not the therapist.
No, there's several of us, yeah.
Yeah. Hey, and actually we got another guest who's off camera this morning, and she can say hello, and you can probably hear it. Her name is Amanda Moody, and she is an intern from UMF. So welcome this morning, Amanda. You want to say hello to the audience?
Hi.
There you go. Okay, so good morning. And so we've got a number of topics this morning. And Jim is going to be talking about strategies for making lasting health changes, and that in itself is going to be pretty interesting because we've all tried to make major health changes in our life, and some work and some don't. So Jim is going to talk a little bit about that. Betsy Putnam, she's so important, we've given her 2 topics to discuss today. She's going to talk about ticks, so that is a hot subject right now, actually. And she's also going to talk about antibiotic stewardship. And then finally, Megan is going to talk about balance and fall prevention, and that also is a very important topic. So anyways, so I go to my notes. Jim, we have these topics this morning. Now tell me why you kind of picked those topics when there are a number of other topics you could have picked.
Sounds good. Well, first of all, I just want to thank Katie and Chris for inviting us here today. We really appreciate it. We could have picked a number of topics. We could have picked weight loss, heart health, cancer, arthritis, diabetes, even substance abuse. So there's a lot of topics that the community's concerned about. But we thought, based on experience, that these topics would be of interest to the community. Ticks, that's such a big deal for people. Over the years, they've been spreading throughout the state, and to the point where people are really concerned about spending time outdoors. And even myself, as an avid outdoors person, I'm very cautious about checking myself when I, come out of the outdoors. I just want to mention too that Betsy, in addition to talking about ticks and Lyme disease today, will be offering a free presentation on Saturday, April 7th from 9:30 to 11, and it's going to be at the Poole & Turner Union Hall in Skowhegan. This is a free program, and we do ask that people register with us, so they can give me a call at 858-2318, or they can see all our community health programs on our website. So that's rfgh.net, or we're on Facebook as well. Also, Megan is going to talk about fall prevention and balance. And one of the things that's a big issue with our elder population. As we get older, our bones tend to get more brittle, and if we fall, it can be really devastating. And about a year ago, the hospital's occupational therapist started a program called Steady. And we've heard rave reviews about this program, And I know they do a great job, and Megan will give us some more information about that. And as Chris mentioned, we'll finish off the program talking about antibiotic stewardship. And I will be starting the program off by talking about making lasting health changes.
Very good. So then we'll start with you, Jim. And speaking of health changes, why is it so difficult to do that? I think I know the answer, but I'm going to ask you anyways.
Well, I think as human beings, we just kind of naturally resist change.
Yeah.
You know, we kind of stick to what we know. And I think there's a couple other reasons why it's difficult too. I think a lot of times we try to do too much. You know, you think about New Year's resolutions, and a lot of times somebody may not be exercising, and then they try to do an hour a day, 7 days a week, and you know, they get overwhelmed and they get discouraged and they lose confidence and then they give up. Also, a lot of times people don't have a plan, so they don't set goals, and that can make a difference as well. One of the biggest factors with health is stress. And, you know, stress, we all have stress. If you're a human being, you know, everybody deals with stress, and stress can be a real barrier to making changes. And I work as a tobacco specialist with the hospital. I work with people to help them be tobacco free. And I know probably the biggest reason for relapse is stress. So having a good plan to manage stress is helpful.
So what are some of the major factors in making health changes?
Well, I think as a health coach, we look at a couple of things when we do an assessment with people. One of the things we look at is motivation, which has a lot to do with a person's reasons for wanting to make a health change. And we also look at confidence. And confidence is the believability that you can do it.
Yep.
And so the good news is if somebody's motivation or their confidence is low, or both, there are some things that they can do to increase these areas.
So how do you increase, say, motivation?
Well, when it comes down to motivation, it starts with self-exploration.
Mm-hmm.
So, and I think a lot of times people don't put a lot of thought into it, but it's really helpful to give some thought as to why you want to lose weight, for example. And when you do this, then you want to make a written list.
Okay.
And another thing that people sometimes do is they journal their reasons. And then you can add a little more detail. And, you know, and then you can refer to it on those tough days as you're trying to keep the weight off.
Yeah, I think it's important to write things down,
Mm-hmm.
you know, and then you can look at it and you kind of hold your feet to the fire a little bit when you're doing something like that, rather than just having these things in your head and often forgetting the rationale behind some of those things. So
Exactly.
yeah. How do you increase a person's confidence?
Well, there's a number of ways, but probably the biggest thing we see is that people get really frustrated with the process of change. So I go back to the example with tobacco. If somebody, you know, makes an attempt to be tobacco free and it lasts only 3 days, then they start to you know, get some of that negative dialogue going. So they may say that I feel like such a failure. You know, why can't I do this? I don't think I'll ever be able to do this. And those messages can really undermine confidence, and they can also be a real barrier to making changes. So kind of looking at the change process differently can really have a positive impact. So it is tough to make changes. That's the first thing. And everybody struggles. It's normal to struggle. You look at tobacco, for every 100 attempts at being tobacco free, only 12 are successful 6 months or longer. So that means that almost 9 out of 10 people that make an attempt today at being tobacco free will still be smoking 6 months from now. So that being said, when you look at the statistics, it is normal to take multiple attempts at being tobacco free, at losing weight. And when you start to look at it that way and you start to learn from your setbacks, that can really make a difference.
So keeping your confidence level up is a very difficult thing, particularly when you're looking at those statistics of only 12 out of 100 attempts does somebody stop smoking for a 6-month or more period. And actually, if you take it out more than 6 months, what's the percentage then?
It continues to go down.
So
Yep.
keeping confidence up, I would think, would be a very difficult thing, particularly in that area. And what are other things you can do to increase your confidence?
Well, one of the biggest things that we try to encourage people to do is to set specific and realistic goals. And an example of a non-specific goal for exercise would be, I want to increase my exercise. So it doesn't give you any direction. It doesn't tell you what you need to do to be successful. If you want to make it specific, you might say, I will walk on the treadmill for 20 minutes, 3 days a week, beginning on such and such a date. And that way you know exactly what you need to do to be successful. And along those same lines, you want to set realistic goals too. You know, people tend to try to do too much and then get discouraged. Small steps really make a big difference. You know, I'll give you a couple of examples. If you look at somebody trying to lose some weight, and let's say that they're currently maintaining their weight, and they're drinking a 12-ounce regular soda every day, and it's got 150 calories in it. So they make one simple change. They substitute water for that soda, and over the course of a year, you can lose 15 pounds.
Wow.
And I'll give you another.
That's major.
Yeah. I'll give you another example. Sometimes we get people in our weight loss classes that are looking to lose 50 pounds, let's say, and that can be overwhelming. When you look at, I got to lose 50 pounds. That can be really a big mountain to look at.
Oh, absolutely.
So what we encourage people to do is start with the first 10. Start with 10. And a lot of positive things can come from that. So first of all, if you lose 10 pounds, your blood pressure, your cholesterol, your blood sugar can improve substantially. Also, for every pound you lose, you take 4 pounds off your knee joints. So a person that loses 10 pounds, for every step they take, they've now taken 40 pounds off their each knee joint. So that's pretty impactful. So small changes can really make a big difference. Another thing that builds confidence is to identify our barriers and then problem solve.
Well, in my mind anyways, having realistic goals is a good thing. I think sometimes people say, well, yeah, I'm going to lose 50 pounds in 2 months. And for most people, that is not a realistic goal. And then they get very frustrated when they don't do it.
Right.
And then they go off the wagon and sometimes just put even more weight on. Okay, so the big thing is, and by the way, you can get a plug for your Way to Go show, Way to Go program, because I've been in that and I have lost some weight. I need to go back in it actually. I could lose a little bit more here, but you have been running that program at the hospital for a number of years now, and a lot of people have attended, and I think you got a lot of success stories that you could tell from that program too.
Yeah, we've got a really great group of dietitians at the hospital that really put a lot into our community weight loss programs. And we are starting a round of, it's an 8-week program, Way to Go, and we start again on April 2nd. So
Yeah.
same phone number.
Yeah. Sign up, please. Yeah, sign up. Okay. Do you have any other strategies for keeping the weight off
Well, I think
after they lose?
I think really sustaining change is important.
Yeah.
And there's a number of, the work's not over after you've made a change.
No.
So one of the things is again, it's how we look at the process. Setbacks happen. If we oftentimes see people that are tobacco free for 3 days and they might have a cigarette, and then they get, they figure they've blown it and they're going to get back to smoking. Well, I think it's, if you view a lapse or a setback as just that and not as full-blown relapse, that can make a difference as well. Also, paying attention to the benefits you see after you've made some changes. That can make a difference. So, for example, if I've started an exercise program and all of a sudden I've got more energy, and I'm feeling less stressed, pay attention to those benefits you see. Also, probably I go back to stress. As you're putting your plan together, if you have some good strategies to manage stress, that can make a difference as well. So it could be exercise or journaling or talking to a friend or listening to a relaxation CD. There's a lot of things we can do to effectively manage stress. So just in summation, I would say that, it's tough to make changes, tough to make health changes, and it's for all of us. It's tough for all of us. And everybody's in the same boat. And the key is to stay with it and to learn from each attempt and to keep at it. And we do see a lot of success stories. So even though it's tough, it certainly can be done.
And sometimes, the reinforcement can come from people around you and people saying, my goodness, you look as though you've lost some weight. And then there's a lot of pride in that, and that gives you that extra motivation to keep at it.
Yeah, and I think I go back to confidence. If you start to make some small strides, we see people get energized.
Yeah.
And it really propels them to keep at it.
Absolutely. Okay, topic number 1 done. Okay, and then on to the next one here, and the next one's really interesting, I think, and very good timing on this, because there's a lot of fear out there about ticks right now, and I know last year was a particularly bad year with ticks, and a lot of people now, you're kind of afraid to go out in your back field or just walk around a little bit. And I know, for example, myself, I used to go out, I have a field out behind my house, I'd go out in shorts years ago, never even thought about it, and now never, pants and all that stuff, and then come in and you're checking yourself for ticks and all that stuff. So anyways, Betsy, what do you think about ticks?
Probably like everybody else, they're horrible little buggers. And, they scare people, they creep people out. Here in Maine, we are not used to seeing ticks. I remember as a child, I didn't even know what a tick was. I never saw a tick. And it's only been in the last 6 to 8 years that I had begun to see them, and of course now we see them regularly, and in some areas there's infestations of them. But I think, like a lot of states where ticks have moved in, the population has grown, we're going to have to learn to live with it, because we can't get rid of them all. And like the people in Connecticut, where Lyme disease was first identified, they just structure their lives around prevention, making sure they do everything they can to avoid getting the disease or getting any tick-borne disease. And we would just have to do the same. A lot of it is getting used to it and building that in, because they're not going away.
Yeah, it's frustrating, because as I said, I used to walk out my backfield in shorts, and now I gotta prepare, and I gotta, put the right clothes on. Probably should spray myself before I do it. All of those things. So
sure, we can talk about prevention first, and that's a good place to start. It's the what we do for any disease. Prevention is always best. So I brought some things with me today.
Oh yeah, props.
Props, yeah, they make the job a little easier. And unfortunately, it has to do with dressing more completely. You have to dress thoughtfully, which a lot of us like, especially in the warmer months, like to be able to just put on our nice, cool clothes and head outside without a thought. But if you're going to be spending time in areas where there might be ticks, and these would be shady, brushy areas, out in the woods, the edges of your lawn, for example, and in some places even your lawn, and you're going to be spending a lot of time out there, there are some things that you can do to protect yourself. One thing is that you can wear long pants like these, and these are lightweight, so they're not awfully hot. Light colored. I used to think that wearing light-colored clothes was recommended because the ticks didn't like light-colored clothes. But in fact, it's because it makes it easier to see them. A long-sleeve shirt, and you want to be sure that you tuck your shirt into your pants, because the ticks can climb up the pants and under the shirt if you don't do that. your light colored socks, tuck your pants into your socks, which is a lovely look. But it's worth the trouble if you can avoid being bitten. You don't have to dress like this all the time. But again, if you're going to be spending time outside, a lot of time outside, working around where you're not really paying attention to what's going on around you, this sort of dress is a really good idea. Now, the other thing is wearing a repellent, and 20 to 40% DEET is recommended in a repellent. This permethrin is actually an insecticide, and you can treat your clothes with this. It's formulated so that you soak your clothes in it. There's directions with the kit. When you use this product, though, it is harmful to pets and to fish. What you don't want to do is expose them to the wet product, the liquid product. So you soak your clothes in it, you hang them out to dry, and that treatment will stay on the clothes through several washings, so it lasts a while. You don't have to do it just the one
good.
time. You can buy clothes that are impregnated with it, actually. It lasts a little bit longer, and it's very effective. So there is that, and I brought this. This is a
Betsy, can I interrupt? How
Sure.
expensive is permethrin?
well. It can vary. I have only seen it in a large size, and it's in the $15 to $20 range, depending. You can order it off Amazon, for
Okay.
example, and it's a little less expensive. If you get it at your local hardware store, it's going to be a little more expensive in the $20 range for the same
Okay,
item.
good to know.
This, I always wear this when I'm doing presentations because for me this is a lifesaver. It is, it's a bug, I call it my bug shirt, and it not only keeps the ticks off me, but it keeps mosquitoes and black flies. This is no-see-um proof as well. And this particular one is really nice because it's got a zipper hood on it. So as I'm working outside, when I get hot, I can put the hood back and have a drink, then zip it up and be back on my way. And with my hat underneath, it keeps it off my face as well. I make quite a picture doing my lawn works. I think the first time a family member saw me dressed like that, it raised quite a commotion. Really, you?
Now, where would you get that?
Oh, this came from our very own Rennie's.
Wow, there you go.
You can order them offline. This particular brand is called Bug Baffler, but there are a number of them. If you just if you have a computer, in the search your web browser, just type in bug shirt or bug prevention clothing, and things like that will come up. And then, of course, after you're finished, coming in from outside, at least once a day, what you want to do is check yourself over for ticks. First, you can use a lint roller, go over your clothing to remove loose ticks. You can run it over your skin as well. Take your clothing off at the doorway if you can, at the entrance to your house, because you can carry ticks into your home, and they seem to get everywhere. So take your clothing off, head to the bathroom, do a tick check, and that is any crease like behind your knees, under your arms, hairline, behind your ears, the places that you don't normally think to look. They can be very difficult to see. There's a number of stages in the life cycle of a tick. In the very early stages, they're very tiny and they're light colored, so it makes them difficult to see. Then there's a mirror to check yourself. I hope I didn't. No. So you can use this mirror to check yourself all over. And if you do find a tick, there are a variety of tools out there to remove them. But what you don't want to do is apply a hot match, fingernail polish remover, Vaseline, soap. People have these kind of folk things that they've always done or they recommend, but those things irritate the tick. And I don't mean make it mad, I mean it's irritating to them. And what happens is they can regurgitate into the bite site if they're attached, and regurgitate the contents, and there can be infectious agents in there, and they can regurgitate it into the bite wound and actually put ourselves more at risk by doing that. So the best thing to do is to use either a very sharp pair of tweezers or or a tool to remove it. And a lot of these tools are designed the same. It's a hard surface with a little notch in it. And say I had a tick on my hand here, I would position this so I'm sliding this notch along, catching the tick, and then lift steadily upwards or continue to push forward with that. And anybody who's removed a tick knows they don't come off easily. Well, that's because the little part that they stick in has barbs on it, and just like a fish hook doesn't pull out easy.
Okay, yeah.
That whole little piece they stick in is lined with barbs. And it's designed that way so they can't be easily brushed away on an animal walking through the brush or a swishing tail or something. So the same with us. They'll be stuck right there. And you lift, 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 and the skin will tent right up even and then pop out. It might take a piece of skin with it, but that's nothing to worry about. Likewise, if the tick breaks off there and the head stays in, don't dig it out with anything. That can create a place for an infection to start. The best thing to do is to leave the head, if it gets stuck, clean the area very well, put a little bit of alcohol on it, and just keep it nice and clean. And your skin will eventually work that out so that it's not stuck in there. And then after you do that, one thing that you can do is to put the tick in a container and date it. Then you have the tick, you have the date you found it on yourself, and then you're going to watch for symptoms to appear, any kind of, and typically what they say is if you feel like you have the flu but the flu's not going around, that's when you might want to start thinking about seeing your provider. And if you do, then you've got the little offender when you found it, and you can take that with you.
Right, absolutely.
For one of the things that they are doing in areas where Lyme is endemic, that is where more than 20% of the ticks are infected with Lyme disease, if the tick has been attached for more than 24 hours, and therefore could have transmitted the disease. If it's a black-leg tick, the Isodes scapularis, that transmits Lyme, and it's within a certain time frame of the bite, and the person can take the medication, they will give a one-time dose preventative of doxycycline. And just to clarify, doxycycline is for children greater than 8, for adults, non-pregnant women. So they would give a one-time dose in hopes of preventing them from getting Lyme disease.
So you what was that, the Latin name you gave for the
Isodes
tick?
scapularis.
Yeah, you all remember that, folks.
We
right?
have the black-leg tick or the deer tick.
Okay, yeah, that's what I was going to get to.
We have 14 species, well, depending upon which source you use, whether it's Maine Med's Tick-Borne Disease Lab or Humane Cooperative Extension. We have 14 to 15 species of ticks in the state of Maine.
Wow.
Right.
I didn't realize that many, yeah.
Well, a lot of them we don't see because they stick so closely to their host, literally. Woodchuck ticks, for example. We very rarely are bitten by a woodchuck tick, but they're the ones that carry that viral illness called Powassan encephalitis that you've heard about. We've had some very rare cases in the state of Maine, one in 2015, one in 2016, and one of the people who contracted it did die, and it can leave lasting neurologic deficit. But and we have the American dog tick that you will see, and that's the one you see most often. It has white on the back of it. The black-leg tick has a little black, I call it a cape. It looks like a little semicircle on the back. That's called the scutum, and that on a black-leg tick or deer tick is just black, and the rest of it is apple seed color, that kind of red-brown color. And they're the smallest of the ticks that we most frequently see.
So what symptoms once you've been bitten by a tick, and what are some of the symptoms that come up? And actually, in a minute, I might have our own Katie Willette has had Lyme disease, and she may want to just for a minute chime in on that. But what are some of the symptoms?
Okay, the first thing that might occur is what they call the Lyme rash. Erythema migrans is the other name for it. And that can appear anywhere from 3 to 30 days after the bite. Although nationally, 70 to 80% of people get that rash, in the state of Maine, the numbers are showing that it's somewhere around 50%. So not everybody will get the rash. Not only does not everybody get it, but a lot of times it is in a place we can't see.
Mm. Mm.
And so another reason for the mirror to check yourself periodically.
Yeah.
So it's that. And then after that, it can be fever, headache, muscle aches, an intense feeling of fatigue. Yeah?
Oh,
I see somebody agreeing over
so,
there.
Katie,
so.
did you experience all of those things? Because Katie got, how many years ago was it, Katie?
30.
30.
30 years ago.
And back then, not quite as
No.
much knowledge of this. And you were in New Hampshire when you got it, right?
Right.
Yeah.
Actually, Limes, Connecticut is named after the tick because I think that's the first place that anyone found the tick.
Mm-hmm.
But the first thing that I experienced was weakness. I was incredibly weak. It took 2 hands to lift my toothbrush.
Wow.
So you know how weak I was. And nobody knew anything about it. And I had a television program going while I was laboriously making the bed in New Hampshire. And finally, this man said that the pain that he had was from Lyme's disease, and I went right to the phone and called the doctor in Skowhegan and asked him if he would see me. And that was the beginning of Lyme's disease, I think, in Maine.
Yeah.
So-
Well, I think we were considered at one time to be a bit far north,
Yeah.
weren't we, for that? And all of a sudden, we certainly aren't too far north.
No, we absolutely are not.
Just a quick
No.
question.
Yeah.
Does a hard winter, like we went through, and as you recall, I'm sure, in December, latter December and into January, some really, really cold stretch. Is there a chance that might have killed some of those little buggers?
Um,
No.
Yeah.
Well, I'm not an entomologist, but what I do know is that there are other factors that come into play. One of them is snow ground cover because that can be insulating
Yeah.
and it can protect them from the cold.
Yeah.
Right.
Yeah.
And so, so just the mere fact that it's been cold doesn't necessarily affect the population that much. And they hibernate in the leaf litter. They get down in the leaf litter, so they're nice and warm down there. And all it takes is a 30-degree day.
Mhm.
And
Mhm.
you will hear people say, I was out walking in the woods in the snow, and look, I got home and I had ticks. I was pulling them off me. So, so although there might be some minor effect from environmental conditions, the fact is we're going to continue to see that population expand. And if you look at the density maps of the United States, the eastern seaboard, you can see over the years it's increased up the eastern seaboard. The upper Midwest has the same problem, Northern California as well.
Mm. That's right. So, like, out in the desert and areas like that, that would be too dry and too hot for them.
Well, there are ticks out in that area of the country, but but not deer ticks. They have different ticks in different part of the country, like the Lone Star tick and
Would they cause
whatnot,
Lyme
but-
disease?
Nope, but they cause tularemia and Rocky Mountain spotted fever. They carry it. It's just there are different diseases. In fact, the Lone Star tick is beginning to appear in southern Maine. So.
Well, see, I was just
not the bearer of good news.
I was trying to figure out where I was going to
Where
move
you
to get away from that.
There's bad stuff everywhere.
Siberia, maybe.
Alaska.
or
Pretty much
Alaska.
gonna have to learn to live
Yeah.
with them, I'm afraid.
Okay.
But, yeah. And the other thing I want to mention is that it's not just Lyme. Lyme. We're focusing on Lyme, but what we're seeing more and more of is a couple of other infections that the deer tick can transmit. That's anaplasmosis and babesiosis. We've had, in the last couple of years, an increasing number of cases that we're seeing at the hospital and also being reported to Maine CDC. Anaplasmosis affects our white blood cells. It's a bacterial infection. The patients that we see at the hospital are very sick. Babesiosis is a red cell parasite, much like malaria, and it's treated with the same drugs that malaria is, that they use to treat for. So, and when those people present to the hospital, they are very, very ill as well.
Very ill.
Yeah.
So, and so, say you've been bitten by a tick and you don't pay a whole lot of attention to it for a while, and then you get a ways into your symptoms. Is it because there's so many potential symptoms and they may overlap with other types of illnesses you can have? Isn't this a pretty difficult thing to diagnose
At one
times?
time, it was called one of the great pretenders because it could look so much like other things. But there are some constellation of symptoms that appear at a time when other things that cause them, like the flu, is not circulating, and you have these muscle aches and a unilateral joint swelling that should bring that up on the differential for a provider. And there are tests that they do. The test that is recommended is a blood test. It's a 2-stage test. And when the first stage of it is where they just test for the antibody, when that is positive, and the antibody is the thing that our bodies form to fight off an infection. They test for that, and then if it's positive, they do a more in-depth test. And typically those can be sure to come up positive 4 to 6 weeks after the disease actually occurs. The interesting thing, I could go on and on, but one of the interesting things about Lyme, the bacteria that causes it, is a spirochete, and that's a little corkscrewy kind of bacteria, and it doesn't like to stay in the bloodstream. It migrates from the bloodstream to the tissues, and that's where it causes the damage, is in the tissues. So it's joints, nervous tissue, the heart eventually can be affected. And that's why sometimes you hear people saying, "I've got problem concentrating and thinking."
Yeah. So so you've got a chronic situation at that point, if you're that far into it, don't you? Or I mean, how do you? So this would, at this point, this is a lifelong thing that you have to control.
Most often, people who are treated, regardless of the stage, the infection itself can be treated. So the infection goes away, but it's the end organ damage that can continue to be symptomatic. And so there are people that go on for a long time. I think we've got an example.
Well,
And I hear it. I do these presentations at various venues, and so I hear these stories over and over again from people.
It's amazing. So your presentation is going to be when and where? It's coming
April
right up. Yeah, and Katie has a question.
Well, I have had many people write to me and talk to me and what have you because of the Lyme's disease. But people don't have to be in the woods or in tall grass. The 2 people that I have heard from received the deer tick at the pool because birds have dropped it.
Oh, God.
And they have been sitting around the pool, and lo and behold, they end up with Lyme's disease.
And one of their favorite hosts is mice. So anywhere you're going to find mice, you can find those. One of the things that they suggest doing is taking this permethrin, soaking cotton balls in it, putting them in like a paper tube, and then setting them out. The mice will take those the cotton back to the nest, and it will kill the ticks. So,
interesting.
I think there's a commercial product that's actually sold like that. You can buy it, but it's cheap just to get some cotton balls and make your own.
Well, let me go back to your talk.
Okay.
Where and when?
Oh, sorry.
No, that's okay.
That's April 7th.
Yeah.
I'll let Jim
Yeah, it's going to
Give the
be
specifics.
it's going to be Saturday, April 7th from 9:30 to 11, and it's at the Poole and Turner Union Hall in Skowhegan. So it's a beautiful place, and for people that don't know exactly where it is, if you're at the intersection in Skowhegan, right by the bridge, if you take 201 towards Fairfield, head out that way. It's exactly 3.1 miles on the right. And
There you
it's
go.
Great parking, beautiful facility, free program.
Yeah. So we tried to cover as much as we could in the time we
I'm
had this
sorry.
morning,
I
but
can't-
go listen to her
Exactly.
at the pool.
Exactly. Would love to have
Oh.
people come. Yep.
Absolutely. Okay. Well, Megan,
Yes.
it's your time. Finally, let's get to you. And Megan, as I mentioned, is an occupational therapist
Yes.
at RFGH, and you're going to talk about a topic that's very important for older people, and even some that aren't so old that may be on medications or other issues. So, so forth. So, anyways, what prompted you to develop this fall prevention program?
Well, great. Thank you so much for having me. But before I answer that, I'll quickly just say with the ticks, I have 3 dogs, and I've noticed I have to check them so much more all the time because they are bringing in the ticks into my home. So just another thing, we have to check our dogs too.
Oh, absolutely.
That's right.
and
Yeah.
cats.
Yep,
And cats.
and the cats, if
Yeah.
you've got a cat going outside.
Yeah.
So, yes, so like Betsy, I don't want to be the bearer of bad news, but unfortunately, falls are also a huge problem that are affecting our community. As a therapist, I'm seeing it every day. People who have fallen and their lives have really been impacted. So I don't want to bore with too much numbers, but just to get an idea of the scope and the gravity of this problem, I'll pose a few. So every second of every day, we're having an elderly person in our country fall. And every 20 minutes at least, somebody's dying as the result of those falls. It's a huge problem. And when we think about how our population is aging, it's going to become even more of a problem. The CDC, the Centers for Disease Control, have put out some numbers about falls and some information about falls prevention. In 2014 was the last time those numbers were put out. In 2014, there were 29 million reported falls in our country. It's estimated that will be 49 million by 2030. So we're going to add another 20 million a year on top of that. It's going to be a huge problem. And you think of how that affects our communities. Well, it not only affects people's lives and loss of independence, but it's also a huge healthcare and economic burden. In 2014, it was estimated that falls cost around $31 billion annually in our country. And when you look at that, that's compared to $36 billion for cancer. So it's huge. You don't realize how much money is being spent to help people after they've fallen. And when you think about we're going to have 20 million more falls by 2030, how much is this going to cost people? So it's a huge problem.
Yeah, absolutely. And of course, the baby boomer
Exactly.
generation is a pretty good sized segment of the population, and they are aging.
Exactly. Exactly.
And so, I hate to admit it, but you get a little less stable as you get older. The bones are a little bit more brittle and balanced, and maybe you're on medications
Exactly.
and things that cause those issues. So you
Exactly.
can kind of see why this problem is going to
Skyrocket.
skyrocket and increase all the time, and it's going to be a huge expense.
Exactly. So,
And-
sorry, go ahead.
No, you
I
go.
was just going to say, so as a therapist, we have tended to be reactive to this problem. We see somebody who's fallen and we treat them and we help them restore their independence as best we can. But because this problem is getting so large, our national organizations, the American Occupational Therapy Association, the American Physical Therapy Association, as well as Medicare and the Centers for Disease Control are pushing all health professionals, including therapists, to focus more on prevention and wellness. Let's try to make a bigger dent in stopping this problem before it occurs.
Always makes sense in a lot of health insurance related
Exactly.
things to to focus more on the prevention side,
Exactly.
and that it certainly can keep costs down significantly. At least we hope so. So we kind of, nationally this is a problem. How, what's the local impact?
So if you think about the population aging nationally, just think about Maine. You're like, oh, well, we're in rural Maine. How big of a problem is it? Well, Maine is an older state. We have an older population in Maine. I think we're in the top 10 of old states, right? So it's going to be even a bigger problem here. So when we were seeing this as therapists, we're like, I feel like this is a big problem, but maybe I'm just, jaded that I'm seeing it more than I am. No, we're seeing it a lot. So when we decided to create a prevention program, a structured program to not only just look at balance and strength, but to look at all the factors that affect risk for fall, we were like, well, let's look at our local area. How big of a problem is it? So we looked at the numbers of patients that were seen in the emergency room at Reddington Fairview from February of 2016 to February of 2017, so a year. And we found that 1,350 patients had been in our emergency room with a diagnosis of some type of injury as a result of a fall. So that averages 112.5 per month. Us therapists are seeing them, and us practitioners in general, there's a lot of people in our community that are affected by this, and that's just the people that went to the emergency room. A lot of people don't.
I was just going to say that, Megan. If there are
Exactly.
112 going to the emergency room,
Exactly.
how many falls were there actually happened,
Exactly.
and with some injury?
Exactly, and I think if we think about it, either we've ourselves, been aging, maybe we feel like we had an illness and we're not as strong as we were, and maybe we're getting up and we're feeling a little dizzy, we're reaching for furniture. Either we've experienced that ourselves, or we've seen a loved one or someone we care about, and maybe they're not as strong as they used to, and maybe you're watching them walk and you're like, oh, yeah, oh, God. You're like, oh, that was a close one. And we're all either have or are going to experience the results of falls.
Yeah. Some of those same people are driving cars.
I know. Well, I'm not judging the driving abilities of anybody.
But it is a little scary. Yeah. So anyways, what are
Yes.
some of the things that people can do
Yes.
to decrease the risk of falling?
So I think one of the most important things to do is for people to be open and honest with themselves and with their medical practitioner. So what we found, we've done this for over a year now, is a lot of times people either are maybe in a little denial or are a little fearful of admitting that they're at risk for fall, or that they're scared to fall, or that they have fallen. So if people can talk to their doctors or their medical practitioners, whatever they have, are you feeling more unsteady? Have you fallen? Are you scared to fall? Because being scared to fall is a risk factor for fall. The more scared you are, the more likely you're going to fall. So talking to your doctor about that, because your doctor can investigate some underlying medical issues that might be going on that could be increasing your risk for fall. We also recommend, and the CDC recommends, that patients regularly or annually at least review their medications with their doctors. Because interestingly, there's a lot of medications that can have side effects that increase your risk for fall. And we certainly aren't suggesting anyone stop those medications, but having that discussion with their doctor. Are you having a change in symptoms? Are you more dizzy when you're moving? Are you lightheaded? Are you having vision changes? Because as we age, as with all things changing, we metabolize medications differently. Mm-hmm. So you might have been on a medicine for a long time, but maybe your body isn't processing it the same. You need to let your doctor know if your symptoms are changing or you're having new symptoms, so that they can investigate that. It's hard to help people if you don't know. So that's some things. Yeah.
I just would like to say that I was at Maple Crest for a long time.
Mm-hmm.
Not as a patient.
Because of my disease, but as activities director.
Oh, nice.
And frankly, most of the people use walkers
Mm-hmm.
and not canes, because the cane would get twisted up with their feet
Mm-hmm.
and cause them to fall.
Mm-hmm.
So when they came to Maple Crest,
Hmm.
out went the cane and in came
The walker.
the walker.
Yeah.
Yeah.
I think for that's one thing that's important is having the appropriate device, right? Whatever's the safest for you and what level you need, and that's something that a therapist can help with. I think there's a little psychological component sometimes of going from a cane to a walker for some
Right.
people, so that's sometimes, something that needs to be worked through, if it's really needed, because for some reason it's tough for some people to accept to use a walker, and understandably, no one wants to lose any level of independence.
Absolutely.
So sometimes hopefully we can help people with their balance and their strength, and maybe they won't need it, but if they do, coming to some type of understanding and acceptance of that sometimes is
Actually,
needed.
people are more secure
That's true too.
if
Once they do it,
do
exactly.
use a walker.
That's true. Once you kind of get over the hump and try it, sometimes it's like, oh, actually, this is a lot
Right.
better. I
Absolutely.
feel safer. It's just kind of getting there that sometimes can be a challenge. Yeah. So other things that's recommended by the Centers of Disease Control and by us therapists is staying active both physically and socially, because obviously physically you want to stay strong and mobile, but research shows that social isolation and increases your odds of depression, and it also increases your risk for fall, not getting out and interacting with others. So that's one thing that we recommend. Having annual eye exams is really important because maybe your corrective lenses aren't quite working well for you anymore. Maybe they need to be adjusted. Wearing supportive footwear. That's an easy thing that we see a lot of people are wearing heels and slide-on shoes, and we're like, maybe you do better with a little more support, So that's important. Lighting is huge. It's found that older adults need 10 times more lighting to see effectively. 10 times.
Wow.
And you'll go in some of these older homes and they're dark walls and they've got the mini blinds and the valance and the curtains, and it's like, So increase the light. Let the light in. It's really important, and it can stop, you might not be able to see as well. That'll help you not trip over things. Remove scatter rugs and all those obvious things. Yeah. Don't have furniture on wheels. But another interesting thing the CDC recommends, which I hadn't thought about it before we made this program, was that older adults take a vitamin D supplement for bone, muscle, and nerve health. Now, I'm not a doctor, so I won't specifically recommend that for anybody, but research has shown that can help reduce risk of falls. So if you're not currently on a vitamin D supplement, I would just suggest that maybe you have a discussion with your medical provider about that. Is this right for me? Is this something that can help me or needed for me? Because everyone might not need it. But that's another easy, simple thing that you can add to kind of your bag of tricks to try to help prevent some falls.
Now, Reddington Fairview has the Steady Fall Prevention Therapy Program. Can you give us just a little summary of that?
Sure. So we started what we call the Steady Fall Prevention Program to help address this, to do more. So what it is it's skilled therapy. So if you came to the rehab clinic for therapy, it's the same idea. It's skilled therapy. It's provided by licensed therapists, but it's a group program. Instead of getting individual therapy, you're getting it in a group. And that way we can make sure that our interventions are based on research and what works, what the research has found to work to help actually reduce falls. Not just improve balance, not just to improve strength, but to improve overall risk factors for falls. So it's a 12-week program, and the patients will be seen twice a week. So you come to a group, and the reason why it's done in a group is because the research showed that people do better when they work in a group on fall prevention, and maybe that's because one of the factors is social isolation. But we found it's a blast, and even people who are like, well, I'm not a crowds person, love it. It's a chance to get out with cohorts. It's a chance to chat. They can share similar feelings and experiences and some knowledge that we don't have, of life experience, or did you know this and did you know that? So it's really, it's it's been really, really fun and heartwarming, to be honest. But so our program's aim is to help people interact, to gain physical skill, improve their balance, improve their strength, their mobility, but also to increase their risk factors of what are some factors that can help you prevent falls, improve your confidence, decrease your fear, and improve your overall fitness and activity.
Okay. We're unfortunately
Oh,
we're running
sure.
a little short of time on the show, and it's because I never stick to script. I gotta go off and ask other questions, and
Sure.
Katie has questions,
Sure.
and all of this stuff. So any. I had some other questions I was going to ask you,
Yeah.
but any sort of quick summary
Yeah, no,
on,
no, no.
on the
I
program?
just want to let people know, if you're interested, that you should speak to your medical provider about it, because we are skilled therapy program. We would be billing the insurance just like any other therapy, so we would get a referral from your medical provider. A prescription can be sent over to the therapy clinic. Because we do it in groups, once we start, we progress over the 12 weeks. So if you got your referral over but we had already started, we just put people on a wait list for the next group.
Okay.
We're running a group right now, but the next one will be available mid-May, and we already have a wait list started. Yeah.
Oh,
You-
excellent. You're going to be on that, Katie? You going to that?
No, I think I got
Well, we'd love to have you. I think you'd have a good time.
However,
Yeah.
make sure that when you say doctor, it also includes your eye doctor.
Yes. Yes.
Yes.
It's very important.
Now, Betsy, we've short shifted you on your topic, but best you can do, anyways, with
That's
the
fine.
antibiotic.
Antibiotic stewardship. And so just like we never saw ticks when we were small, at least not in these parts, what we did see a lot of was antibiotics. And as a result, what has happened is there's a worldwide concern about our dwindling supply of effective antibiotics because of bacterial resistance to those antibiotics that have always been used to treat them. And so what you will hear more and more is from your primary care provider at hospitals. You'll hear this term antibiotic stewardship. Well, it's not just the doctors, it's all of us as consumers, community members. We've come to expect an antibiotic when we go in with a sniffle, or we're just not feeling quite right. Well, it must be an infection. Give us an antibiotic, we'll feel fine. But that's no longer the approach. And we have to be careful stewards. Stewards means we take care of this resource that we have. So we want to take care of them. And one thing that we've done at Reddington this year is, for people who come into the emergency room and they have cough and cold, it's awfully hard to hear sometimes, no, we're not going to prescribe an antibiotic. This looks viral, and antibiotics don't work for viral illnesses. So one of the things that we have started to do, for example, and that people can do on their own, is to get a drink bottle and fill it with things that actually can help you. And this is alcohol hand rub, because you want to keep your hands clean. And keep unclean hands away from your T-zone, where you can get infected. We have little alcohol wipes. And oh, don't we all like a cup of tea when we're not feeling well?
Oh, yes.
Some cough drops, a Tylenol, and we will take this out for certain age groups and things, because it's not for everybody. Tissues, and a mask.
Uh-huh.
Yes.
And we have those at the points of entrance at our hospital too, but you can, you don't have to just be in the healthcare setting to wear these. These will both protect you and prevent infectious droplets from getting out into the general air. And then a little card in here about antibiotic stewardship. And one thing that I wanted to mention was that each year in the United States, about 2 million people are infected with antibiotic-resistant bacteria, and 23,000 people die from these infections. So, like the numbers that you were putting out, this is a growing issue. And the other is the increase in C. diff that we're seeing, which is an antibiotic-related illness. So, there. Did I make that short enough?
Boy, she did. She did great. She did great. Well, I think we're almost at the conclusion of this. I'm assuming we are, John, right? And any closing comments, Jim? at all?
Well, I think I would just refer to our website again, rfgh.net. We list our community health programs on the website and have a lot of terrific programs. And you can also call me at 858-2318 to register for these programs.
And there's always a Way to Go program going
Yeah,
on, right?
yeah.
Is that year-round, Jim, or is that just...
We do, Way to Go is an 8-week program. We do it 3 times a year, usually January through March, April through the end of May, and then September through November. But throughout the course of the year, we offer free weekly weigh-ins. So if people want to continue and continue to track their weight. And actually in the summertime, we get close to 40 people that
My
participate in
goodness.
that.
Yeah, well, it's a long-running program and a very successful one. You wouldn't keep doing it if it wasn't, and if there wasn't the need, because there's always a need.
We've actually started to track long-term weight loss success, and we've now got 75 people in a database that have come 6 months or longer, and we have close to a 30-pound per person
Wow.
average weight
Wow,
loss.
nice. That's a
That's
success story.
significant, Yeah.
Well, anyways, I would like to thank Jim Fortunato and Betsy Putnam and Megan Fortier for coming on the show. It was absolutely a completely interesting show on all topics, and we tried. Excuse me. We tried to get them all in. I'm all choked up about this. We tried to get them all in, but we couldn't quite do it. But we
that's
covered it.
good
We
to
covered it
know.
pretty
Yeah.
well. We covered it pretty well. Okay. So the show is over, and now you know.